Diabetes is associated with a high risk of complications related to the blood vessels. These complications include heart attack, stroke, and circulatory problems in the legs that can cause pain and gangrene. Diabetes, and especially hyperglycemia, cause the heart and blood vessels to age more quickly. People with diabetes are 2 to 4 times more likely to develop a vascular disease than people without diabetes. Also, cardiovascular disease is the leading cause of death in people with type 1 and type 2 diabetes. What is atherosclerosis? Atherosclerosis is the narrowing and hardening of the arteries caused by an accumulation of fatty deposits called plaque. The walls of the arteries become less elastic and their diameter narrows, which prevents optimal blood flow. Organs that are supplied by the damaged blood vessels may not function properly without the appropriate blood supply. Diabetes acts as a catalyst by increasing the vascular inflammation that causes atherosclerosis. The arteries that are usually affected are those that supply blood to the heart, brain, and legs. This can lead to angina pectoris, coronary heart disease, myocardial infarction or heart attack, stroke, and kidney failure. Together with your doctor, you'll determine your risk of developing cardiovascular disease. Some factors increase your risk, including having a family history of cardiovascular disease, ethnicity, age, high blood pressure, dyslipidemia, abdominal obesity, smoking, a sedentary lifestyle, and certain eating habits. Dietary factors associated with cardiovascular disease include having a diet high in added sugar, low in dietary fiber, high in saturated fat, and low in vegetables and fruits. Once your level of risk has been determined, your doctor may suggest a resting electrocardiogram, or ECG. This test is repeated every 3 to 5 years, depending on your age and level of risk, or if you decide to start a more vigorous or prolonged exercise program. You can take action to lower your risk of cardiovascular disease. To lower your risk, adopt a healthy lifestyle. Maintain your blood pressure within target values. Maintain your blood glucose within target values. Take medication for high blood pressure if appropriate. Take antiplatelet medication if appropriate. And take a lipid-lowering treatment if appropriate. This aggressive management of all of the risk factors should be started as soon as possible to get the maximum short and long-term benefits. Adopting a healthy lifestyle means eating in a healthy and balanced way. For example, by following the balanced plate model, the Canada's Food Guide, or a Mediterranean, vegetarian, or DASH diet. Be active on a regular basis. The current recommendation is to do 150 minutes per week of moderate physical activity on at least 3 non-consecutive days. Manage your weight. In people whose waist circumference is 102 centimeters or more for men and 88 centimeters or more for women, a 5 to 10% weight loss can reduce your risk of cardiovascular disease. Quit smoking. Smoking increases your risk of heart attack by 1.4 times and increases your risk of stroke by 30%. Drugs are available to help you quit smoking. And manage your stress. Relaxation techniques such as yoga and meditation can help you manage your stress. Research has shown that lifestyle changes made within the first year of diagnosis have the greatest impact on your risk of cardiovascular disease. The blood pressure target for the majority of people with diabetes is less than 130/80 millimeters of mercury. To maintain your blood pressure below this threshold, you should reduce your consumption of salt and alcohol. If medications are prescribed, take them at the recommended times and doses. It's also recommended to monitor your blood pressure yourself by measuring it on a regular basis. Maintaining your blood glucose within target values is the overall goal of diabetes management. Blood glucose targets are individualized based on age, how long you've had diabetes, the presence of complications, and your risk of hypoglycemia. For the majority of people with diabetes, the blood glucose targets are a glycated hemoglobin of 7% or less. Glycated hemoglobin measures your average blood glucose over the past few months. a fasting blood glucose of 4 to 7 millimole per liter. A fasting blood glucose is a blood glucose reading taken on an empty stomach or before a meal, and a blood glucose 2 hours after a meal of 5 to 10 millimole per liter. You could find more tips on how to manage your blood glucose in our other video courses, Diabetes 101 and Eating for People with Diabetes. For many people with diabetes, it is necessary to take medications for high blood pressure. Sometimes these medications are recommended even in the absence of high blood pressure if the risk of cardiovascular disease is high. These drugs belong to the classes of angiotensin-converting enzyme inhibitors, or ACE inhibitors, and angiotensin receptor blockers. These drugs have proved beneficial in preventing cardiovascular disease over and above their effect on blood pressure. Another treatment often recommended for people with diabetes is antiplatelet drugs, commonly known as blood thinners. For people with diabetes who already have cardiovascular disease, a daily low dose of acetylsalicylic acid, or aspirin, may be prescribed. In the prevention of cardiovascular disease, further evaluation is needed before recommending acetylsalicylic acid to ensure that the benefits outweigh the risks. Even if aspirin is available over the counter, speak to your doctor or pharmacist before beginning to take this medication daily. A final type of treatment that is often recommended for people with diabetes is a lipid-lowering regimen to lower their blood cholesterol. Drugs from the class of statins are recommended for people with diabetes over the age of 40, people over the age of 30 who have had diabetes for more than 15 years, and people with diabetes who already have cardiovascular disease. When lipid-lowering therapy is started, blood tests are scheduled every 3 to 6 months to validate the effectiveness of the treatment or to modify it if necessary. The goal of this video course was to review the complications associated with diabetes in a frank way. We need to face reality. Diabetes increases the risk of developing complications that affect almost all parts of the body. You can, however, take action to prevent and delay the arrival of future complications. Maintaining your blood glucose, your blood pressure, and your blood cholesterol within target values may not change much in the short term, but in the long run, small changes to these parameters can have a big impact. First, ask your team about the target values you need to reach for your particular situation. In this video course, we presented common targets, but yours may differ. Your healthcare team will customize your targets based on your personal characteristics. If you have questions about your blood test results, be sure to discuss them with your healthcare team. And finally, be diligent about attending your medical appointments and having the prescribed tests. No one enjoys having blood samples taken, but these tests give your healthcare team essential information. If you would like to read more about the complications associated with diabetes and how to prevent them, Diabète Québec has created a series of documents on this topic. You could download the documents using the links in the description of this video. To be notified about our upcoming video courses, don't forget to subscribe to our channel. This course has been made possible with the financial support of Rush Diabetes Care, a division of Hoffman La Roche Limited.